I want to create a little more context for it all, and you're included in this. So picture me, a young student, the bottom of the world, New Zealand, Otago University, it's right close to Antarctica. And I'm studying to be a psychologist in applied behavior analysis. The context is one of being in a practice, being trained in a practice so different from anything that I was about to witness. This is middle of 1983, and this friend of mine, a social worker, this is in Dunedin, and he says, I've just been to the most extraordinary weekend in my life. There's this guy, he's a social worker from Adelaide. There was about 30 of us. I think this is his first time, maybe a second time in New Zealand. I hear he's coming back. You really need to go and meet this fellow. And I could see how moved he was, and he told a story about sneaky poo. And I was, at that time, graduated from working with rats, and now I'm in a clinic working with children who, the psychological term is encopresis and enuresis. And so I'm doing reinforcement schedules, and I'm the expert directing the exhausted, tired and run-down parents to gather data and apply all of these treatments. So it so happens that the next year, and it's around July, August, this is 1984 in Christchurch, New Zealand, and there are two people doing a 4-day workshop. And it's David Epstein, a now quite famous family therapist in the Leslie Centre in Auckland, and this fellow from Adelaide, Michael White. And there's probably about 75 people in a sort of tiered lecture theatre at the University of Canterbury. And I was mesmerized for 4 days by David and Michael bringing me into a world that I did not know existed. And, so much happened then, and I think that 4 days was completely transformative in terms of my practice from that day forward. And I had to, when I went back to the university, of course I'm still training to be a psychologist, but I had to be the most subversive student that you could ever imagine, hiding these new learnings, because if I declared it, I think I would have been drummed out of the program. Just as an aside, later on, I had David come and he did numerous trainings with these psychologists and bringing what then became narrative therapy to the profession in the New Zealand psychologists group. Just the two of them standing there. David's at one side of the lecture room, Michael's at the other, and they're so playful, and the twinkling of the eye, and they're super provocative. Both being somewhat affected, they probably wouldn't admit it, by some of the strategic ideas of the age that had come before, and it was the provocation that thoroughly captured my attention, and the wondrous stories, and the stories with children dealing with stealing that you talked about, asthma, night terrors, and those kinds of things, and then Michael's work. In those days, it wasn't narrative therapy, and again, 1984. And I remember them both saying, we don't have a name for this. And we're really reluctant to give it a name. Because if we give it a name, it's going to stagnate and become, solidified. and to think about what you were talking about in 1984 and then how that work has evolved and developed. But I remember Michael saying that he had refined the ability to lean backwards on his chair and fall off his chair in surprise at some emerging new idea that this child had, that they were sharing with the family, and he was able to create shock. And you were able to create shock. You both were good at this. Just to kind of create a presence where people are thoroughly captivated. And that was both in the teaching. So I'm making links between the teaching and then the therapy.